DOGE begins to freeze healthcare payments for extra review. DOGE is putting new curbs on billions of dollars in federal grants, requiring officials to manually review and approve payments that were previously routine. The U.S. DOGE Service is putting new curbs on billions of dollars in federal healthcare grants, requiring government officials to manually review and approve previously routine payments, and paralyzing grant awards to tens of thousands of organizations, according to 12 people familiar with the new arrangements. The effort, which DOGE has dubbed Defend the Spend, has left thousands of payments backed up, including funding for doctors and nurses' salaries at federal health centers for the poor. Some grantees are waiting on payments they expected last week. The Trump administration is pushing to cut federal spending and crack down on grants that political officials say conflict with White House priorities. DOGE, which stands for the Department of Government Efficiency, said the new initiative, which is being rolled out across parts of the Department of Health and Human Services, will force grantees and officials to justify spending and create transparency. Thanks to the great work by at HHSGOV, for the first time ever, the American people will be able to see line-by-line payment descriptions and justifications, coming soon to the DOGE website, the group posted on X last Saturday. Typically, an organization that has been awarded a grant does not receive the funding up front. The money is held in a secure account managed by the government, and an organization will request drawdowns, tranches of money periodically throughout the year, to cover expenses such as salaries or research costs. Under Defend the Spend, organizations must now include a justification for each transaction. Federal officials then review the justification before deciding whether to approve the payment. The process has been abruptly instituted at the National Institutes for Health, the Administration for Children and Families, and other parts of HHS, with inconsistent instructions on how to proceed, said the people familiar with the arrangements, who, like others, spoke on the condition of anonymity because of fear of reprisal. They also described immediate backlogs in processing payments. HHS said in a statement that the DOGE effort would not threaten support for critical programs and was intended to root out fraud and abuse. The era of rubber stamping is over, the HHS statement said. Current and former federal officials said the process would create bottlenecks. Instead of cutting red tape, they are strangling grantees with it, said Robert Gordon, who served as the HHS Assistant Secretary of Financial Resources during the Biden administration. Some officials have been told that only Trump political appointees can sign requests to disperse funds, even if a career official has already approved it, adding an additional layer of review. The justification for each payment also must include an explanation of how the money will be used to advance Trump administration priorities, according to two employees in separate agencies who received high-level briefings on the process.